Now, just to point out that the type of work that was just described showing the effects of nutrients on these infected cells is not work that is done in isolation. We are not just a lone group of people working in a certain corner of the United States or Europe, if you will, that are seeing these results. There are other researchers who have observed benefits of micronutrients in HIV infection and AIDS. And I have summarized here several different studies, the most important being these are studies in people, not just in cells, in actual people, that these nutrients and their combinations have been tested. And the results that were obtained have been published in scientific journals, which are distributed all over the world. I have just picked a few studies to illustrate this. Starting very early on in the AIDS epidemic, it was observed that if HIV-infected people, AIDS patients, took high doses of vitamin C, they were monitored by a physician by the name of Cathcart, Robert Cathcart, who published his finding on hundreds of people. They were self-medicating with large doses of vitamin C. Cathcart reported that they experienced improvement in immune cell counts, CD4 cell counts, as well as they had lowered opportunistic infection. Just high dose of vitamin C in people. Also, very early on in the AIDS epidemic, two studies published back to back in the early 90s showed that merely consuming a multivitamin tablet, these are in HIV seropositive, asymptomatic individuals who didn't have any symptoms of AIDS, by merely consuming a multivitamin tablet, it retarded, it slowed down AIDS development, manifestation of symptoms of AIDS, interfered with disease progression. Subsequent studies combining nutrients, vitamin C and vitamin E. A Canadian study, the markers of oxidative stress, which is very common in HIV infection, went down, as well as viral load levels of HIV went down. Another combinatorial study, vitamin C with NAC, done by a group in Europe, in Finland, that by taking these two nutrients, it improved immune response and lowered viral load in advanced AIDS. More recent work, multivitamins tested in Tanzania in HIV-infected pregnant women. It reduced death in the newborn, and it also improved the immune status of HIV-infected mothers. Another study done in Bangkok, HIV-infected individuals, sponsored by the World Health Organization, showed that multiple micronutrients increase survival among these individuals. This was again a combination like a nutritional supplement that we have been talking about. More recently, study in San Francisco using a broad spectrum micronutrient supplement improved the CD4 cell counts in these people. And here I have summarized two studies published last year. One using selenium. We talked about selenium earlier, that there is not enough in foods and there's not enough in soil. Selenium supplementation in HIV infection lowered viral load and also improved CD4 count. Now when somebody takes an antiretroviral drug, they may experience that the viral load goes down, but the CD4 count doesn't necessarily revive or come up. This is a nutrient. This is not even ARV, just a nutrient. Improved CD4 count. And same year, 2007, A study with HIV-infected people at the Mengo Hospital in Kampala, Uganda. Some Canadian researchers were involved in this work with the local physicians there in Uganda. They used a nutritional supplement containing multiple micronutrients, and it was shown to delay the progression of AIDS in this population, as well as improve some other parameters. So finally, I'd like to very briefly tell you about the results that we've obtained with the nutritional supplement that we have been distributing through Sanco in South Africa. We came to South Africa in 2005 with these types of results already in the literature. We were interested to see what a combination of micronutrients, what type of impact it would have in people affected by AIDS in townships, different provinces in South Africa. We first started in Kailicha because Sanco had a community health initiative that was running, and so the Rath Foundation donated a multi-micronutrient supplement to Sanco. And Sanco distributed it to people affected by AIDS in the Kailicha Township. I'd like to just summarize some of the results that we have seen because we took the data from the questionnaires that were filled by the patients and did an analysis just to tell you what the nutritional supplementation does. So this describes our program. I already mentioned that we provided the supplement and Sanco distributed it. Initially about 100 HIV-infected patients participated. They were selected by community health professionals. These were individuals who had symptoms of AIDS. They were HIV positive, adult men and non-pregnant women. None of them were taking ARV drugs. In our first pilot program, all of these individuals, nobody was taking ARV drugs, and they took on to the nutritional supplement that was distributed by us through Sanco. And this nutritional supplement, you are familiar with, has these different classes of nutrients. It combines all these classes that we have talked about. Vitamins, minerals, trace elements, amino acids, and polyphenols from green tea. That's what makes up this nutritional supplement. It is supplied in the form of tablets, which are taken 3 times a day with each meal. This is just to tell you how we do the evaluation, how we evaluate the results. At the beginning of the program, when there is the first visit called visit 1, the participants in Kailicha were first examined by a physician. They were given a nutritional supplement and they were asked to return every month to get a refill and to be evaluated. And at each of these visits, starting with the baseline visit and monthly visits thereafter, their health status was assessed. They were asked to fill out a questionnaire and to indicate on the questionnaire their symptoms profile based on a score of 0 to 4, to indicate on the questionnaire what the severity was of the individual system, of the individual symptoms, So this was done at each of the visits.